So yesterday morning I woke up feeling a little bit rough. I had some sort of sensations of hot and cold, woke up with a really bad sore throat, and also just my nose just kept running all over the place. And you know that sensation when you just can tell that something in your body doesn't feel right. I know when I feel sick or when I'm feverish, and I guess it was just one of those moments. I work in a hospital in London, and as part of the staff testing program, we have home testing kits, which we need to use twice a week to make sure that we don't have COVID, and it keeps us safe, it keeps our patients safe. So this is the box that they give us for the testing kits. Basically, they give us little testing strips in these little containers. We swab ourselves, we dip it in, and there's a little device inside that basically tells us whether they've detected COVID or not. So as part of the routine checks, I basically did one yesterday and found that it came back positive, which was a little bit of a surprise actually. It wasn't entirely consistent with the typical symptoms of COVID, which are things like shortness of breath, really high fever, or a change in your taste or smell. So I called the hospital and told them about my results, and in turn they sent over a proper swab, which is a viral PCR swab, and I think PCR stands for polymerase chain reaction, which is essentially a more accurate form of testing for the COVID RNA. This morning I got a text message letting me know that it was positive as well. So with both of these tests being positive, that means I basically undisputedly have coronavirus, and I will be self-isolating for the next 10 days. So how do I feel symptoms wise? Well, my symptoms have sort of been up and down since yesterday. Yesterday, as I mentioned earlier, was hot and cold chills, a sore throat. I have had a mild cough, which is sort of a niggling one occasionally. Haven't been feeling short of breath, and it just feels like there's this really weird sensation in the back of my nose and sort of throat, so the nasopharyngeal region, where it just feels like something is tingling or it doesn't feel right. All in all though, actually, by yesterday evening, with the help of some paracetamol, I've been feeling okay systemically. This morning, woke up feeling fairly rejuvenated. Didn't feel like I had any temperature or anything. It's more just sort of, I feel slightly under the weather, but only in the sense of flu-like symptoms. So I'm quite lucky that it's not been severe so far, but it obviously might change in the next few days. And I'm gonna have to keep quite a close eye on how I'm doing and any deterioration of my function or worsening of symptoms. I also know that I am a young, fairly fit and healthy individual with no comorbidities, but it's not something I take for granted, and I will still be quite cautious going forwards. Just reflecting on the last couple days as well, I actually last worked on the Sunday, which was the evening before I started having symptoms, which was a little concerning when I thought back at it, and I was actually speaking to someone from the occupational health team about this as well. But actually at work, we keep to fairly strict personal protective equipment guidelines, which means that basically at all times I am wearing a surgical mask and my glasses. With all patients, I'm wearing gowns and gloves, which I change on a regular basis. And I also change my face mask and wipe everything down with my alcohol rubs. The risk is still there, undoubtedly, but it's good to know that I took all the precautions to minimize this, especially now that I have tested positive. And I guess working on the front line, that is just a risk that you have to accept, whether that is the safety of yourself or the safety of others. I think that for the last couple of weeks, I've basically been seeing multiple COVID positive patients every single day without fail. So I've definitely accumulated a lot of exposure to the COVID particle and antigen during this period of time that may or may not have actually just been sitting inside me at low viral loads, and all it would have taken was just one patient that I saw with a particularly high load to push me over the edge. Anyone seeing these positive patients, including myself, has to accept that there is a certain amount of risk associated with seeing COVID positive patients. With those possibilities come a risk to yourself, a risk to your colleagues and friends getting infected, and then a risk of you or one of your colleagues passing it on to other patients. And that's really highlighted to me the risk of being careful. I have always been careful. At the end of all my shifts, I make sure I carefully dispose of my scrubs, which are the clothes that we wear in the hospital. I use multiple alcohol wipes to basically clean down everything I own, including my goggles, my lanyard, my bag, my phone, my wallet, my keys. And I do it again when I get home because I don't want to bring anything into the house and endanger my flatmates. And I have been careful. But again, with weeks of exposure that really accumulate, I think that it was only bound to happen, unfortunately. I actually just had the vaccine last week as well, which I know takes a few weeks to kick in terms of helping your body produce antibodies and have that level of immunity. I was hoping that I would be able to brave it out for a little bit longer without exposure, or at least adequate exposure, to the point that my vaccine would help me gather a certain level of immunity. But it looks like that wasn't the case, unfortunately. But there's nothing I can do at this point. I think it'll be good to just sort of rest, withdraw a little, spend some time with myself and just relax and rest up from all those crazy shifts and everything that's been happening in the last couple months. I guess COVID does affect everyone in different ways, and I don't know how it's going to affect me down the line. Obviously, these are still fairly early stages, but hoping to stay safe. I know my family and friends are worried about me, so yeah. I think that's all I'm going to share for today. For me, it's just now resting and recharging. Maybe by sharing my own experiences, people will be able to see what to expect and how to cope with it. So maybe I'll try and talk a bit about that and just track my journey for everyone. But otherwise, for now, I think I'll just leave it here. It was good to just speak out and reflect. So I guess I will see you all around, and yeah, I'm just gonna get some rest. See you later.